Hi, I'm Joy, a registered veterinary nurse at All Pets Vets in North Wales. We're a silver accredited cat-friendly clinic and I'm the cat advocate, making sure that we meet and maintain the cat-friendly standards required. In this video, I'll go through some top tips for looking after your senior cats at home. Ideal diets for senior cats are designed to maintain their body condition with high quality protein, but look after the kidneys with low phosphorus levels. Feeding wet or dry food is fine, but your cat may drink a little more water if fed a dry diet only. Feeding little and often throughout the day, say 4 to 6 times, is better than 2 main meals. Older cats tend to have a reduced sense of smell and taste, so you may need to experiment with flavours or warm the food up to make it a little more appealing. Place your cat's food away from their water sources, as in their heads, their food will contaminate their water sources as they are normally eating small prey animals. Make sure their bowls are shallow and wide, and ceramic is usually best. If your cat is a little arthritic, raise the bowl up onto something to make it easier to reach. Alternatively, you may use activity feeders to extend feeding time and provide extra stimulation. There are loads of different options to use with wet or dry food. Microchip feeders can mean that multiple cats are eating the most appropriate diet and that everyone is getting their fair share. Having water available on different levels of the house will encourage your cats to drink more. Make sure your bowls are wide and shallow. The ceramic or glass types are usually best, and freshen them up regularly. Cats often prefer running water, so maybe try a drinking fountain to keep them more hydrated. Have the water sources accessible, keeping them away from the wall so the cat has a good view of what's going on around them whilst they're having a drink. Sometimes older cats can start to have accidents outside their litter tray, often just next to it. This can be as simple as the tray being difficult to get into. A shallow tray with easy access, maybe with a section cut out of the side, can really help in these situations. Using a large tray is also wise, as your cat needs plenty of room to posture appropriately. Also, the litter in the tray may be uncomfortable on their paws and joints, so consider a fine sand-like litter which is more gentle on the paws. Place these easy access trays in private areas on different levels of the house, so when they need to go, they don't have to make a trek, as they might not get there in time. If your cat prefers to toilet outdoors, can they still use the cat flap? Using a small step up to the flap may help them use it more easily and continue their normal routine. Cats may well sleep more as they grow older and really benefit from comfortable warm beds. Placing a cushioned bed near a radiator or using a specific radiator bed can help to ease pressure on sore joints and reduce pain. Cats often like to sleep and rest high up so they feel safe and secure, so make sure they can still reach their favourite spots by using steps, moving furniture or creating a ramp. And this goes for their chosen lookouts too, if they have a favourite windowsill, for example. Helping them to continue their day-to-day routine will reduce anxiety and maintain their quality of life. Consider some playtime with your cat. After all, they still have their hunting instinct, they're maybe just not as motivated to go out and do it. Some gentle games with a feather toy can get them feeling lively again, can help maintain muscle mass, and it's a great way for you to have fun together. Even if your cat is lying down and batting with their paw, the mental and physical stimulation will only do them good. If your cat is not grooming themselves as much these days, you can help them out with some gentle grooming, including cleaning their ears, eyes and back end if necessary. This will help to maintain their skin and coat, give you a chance to look over them for any lumps or bumps, improve their circulation and their demeanour. Make sure you take care if your cat has any bony areas and use gentle brushes. You may also notice that their nails are starting to become longer and thicker. Nail sheaths don't shed as easily with age, and if they continue growing, they can curl around and grow into the paw. So be sure to keep an eye on them regularly. Your cat might prefer horizontal options for scratching, such as cardboard scratches, as they're easier for them to use. There are some health conditions more common in older cats, such as dental disease, arthritis, an overactive thyroid or kidney disease. And there are lots of signs that cat owners can look out for at home in order to pick up on changes in your cat's health. That could be an increase or decrease in appetite or thirst, physical difficulty when eating, a change in frequency or volume of urination. Are they toileting outside the litter tray? Has their coat become matted, scurfy or thin? Are they losing or gaining weight? Is there any changes in their sleeping pattern, vocalization or activity levels? Are they playing or hunting less? Are they spending less time outside? Consider booking your cat in for a checkup specifically for seniors, and your nurse can discuss lots of aspects of senior cat care, screening for health conditions and ways to improve their quality of life as they grow older. I hope my tips will be helpful. Thanks for listening.